next question was again from Bethany, and she said she was recently undergone gastric bypass and was beginning to look at taking Clomid. So is there any information or anything you'd consider if someone had recently done gastric bypass and was looking at IVF?
Yeah, well, the gastric bypass will not hurt your Clomid absorption. Clomid is a pill. It's the oldest fertility drug ever. It goes back 70 years, and it was originally developed by pharmaceutical companies as they wanted to make it a birth control pill because it was similar to estrogen, so they thought they could suppress ovulation with it. This goes back so far. And what they found out when they studied it was that if it does the opposite, it is an anti-estrogen, and so it fools the pituitary gland into thinking you don't have enough estrogen, and so your pituitary gland actually secretes more FSH, and it stimulates ovulation or stimulates better egg recruitment. So Clomid is the classic first route that people will take if they're infertile before going to IVF. And in fact, if you do IVF, very often we'll just use Clomid anyway, even with the IVF, because we're injecting the sperm into the egg and we can freeze the embryo, so we don't worry about. The one side effect of Clomid that you do have to worry about is it thins the uterine lining. It's an anti-estrogen, so it'll make implantation of the embryo more difficult. So you may not get pregnant on Clomid anyway. You may still need IVF. Freeze the embryos, and then transfer them at a later date. But I'm really glad to hear that you had the gastric bypass and it's working, because obesity is maybe the #1 health problem throughout the world in developing countries, certainly in the United States. And it's so hard to tackle it. And so gastric bypass has made an enormous difference. And so I hope that it's helping you a lot.